Hello, my name is Brianne Cook, and I'm doing this for Mr. Hasan's health communication class. You can introduce yourself.
I'm Adrienne Barber.
And this is my ex-colleague from Lamar. We went to Lamar, that's where I'm from, Beaumont, Texas. We went to Lamar, and then I transferred here to TSU. She's now graduated, and mine is up and coming in December. So we're going to go ahead and begin with the interview. So where are you from? And just give us a little background information about yourself.
I am from Anchorage, Alaska. I moved to Beaumont, where I work there, and I'm an Odyssey Hospice.
Okay. So explain, what does Odyssey Hospice do? What are they responsible for?
Basically, we are the people that develop with the people. As far as going home with the patients, we are the last seen with the patients before they pass.
So what is your current title? Are you considered a hospice nurse? Are you an LVN, a registered nurse?
I am a Odyssey Hospice. Also, I work in the healthcare.
Okay, and your title as far as your qualification, are you CNA, LVN, or RN?
RN.
Okay, and that is a
Registered nurse.
which takes how many years to obtain a degree? 2 or 4?
2.
Okay, so the difference between the two, LVN and RN, is going to be those extra 2 years. LVN, they have a little bit more responsibilities, obviously a little bit more money. Is that right?
Right.
Okay, so as far as you being a hospice nurse, did you know, like, early in life what you wanted to be? Like, let's say whenever you were a kid or a teenager, did you always know what you wanted to be?
I would say yes, because there in Beaumont, where I'm at now, my mother works there. So I've always wanted to follow in her footsteps.
Okay. And even that you knew that she was usually on the day-to-day basis dealing with people who passed away and who were terminally ill, you still wanted to pursue that career?
Well, of course.
Okay.
To meet different people. Odyssey Hospice, basically, we're more connected with the family.
Okay.
We're with them, the patient, and the family.
So you kind of answered this one. So you would say that your mom was your role model?
Yes, my mom's role model.
Okay. And how does she deal with, and as well, how do you deal with, again, people passing all the time, and a lot of that is dealing with death versus dealing with so much as life? How is that for you?
I would say it's a gift and it's a little bit of a curse. I would say it's a gift because you get to get that compassion with members, as far as older people, younger people, by the way that you communicate with them. You get to learn a little bit more about them. And if you notice, most of the time it's starting off, they're not always so open. Mm-hmm. But once you work with them, they become open and you get a relationship. And the curse is, we all have to go, but it's that closeness when you get close with somebody and they're gone.
Right, understood. Okay, if you could for us describe your education, what type of courses did you have to take? What are some of the challenges that obviously you overcame while being in college?
Well, first of all, I would say the courses would be genetic concepts, pathophysiology, most of any health classes, basically. All health classes are required. Some of the things that I had to overpass would be, it doesn't take long, but it's a lot of studying. It's very hard work. Yeah. You have to have a passion about what you're doing. Because if you don't have a passion for what you're doing, you won't do it.
Right. I've seen the nursing books. They're on the thick side.
Yeah.
They're not light by any means. So that's good. And you also had to study the medical coding, right? Medical codes are difficult. They are not easy by far.
Tends to be a little bit of a ruckus.
Right.
It's pretty much, it's all about what you want to do. You know what you want to do, you go after it, give it your best shot, and that's all you do.
Right. And do you feel like you're going to pursue any more education-wise, master's degree, PhD? Are you ever going to go from being a nurse to a doctor?
Yes.
And what are you going to pursue?
If anything, I would like to be a heart surgeon. So if anything, it would go further from being a hospice to where basically I would either be more into the hospital-wise to where I would let go of the patients on the outside.
Okay. And was any communication courses required within your degree plan?
Yes.
And which one was it? Or background of it, if you can. I can't remember my classes here and I'll take them now. So just a background version of what the communication class required.
Some of the classes that are required is as far as, I would say, like I was saying, most of the health classes, some of the core classes, genetic concepts is going to be like the hardest one.
Okay.
So it's going to be a tough one. You're going to take a little while in genetic concepts.
What do you like most about your job? And then backdoor, what do you like the least?
What I like the most is, as I was saying earlier, once you get a patient to open up, it's so much life that you can see come out of them.
Right.
The worst thing that I would say is my weakness is those new patients, because you don't have the same patient all the time. Mm-hmm. So you have maybe a variety. Mm-hmm. So the people that you have that you're used to, it's more easy. But the people that you're just meeting, it becomes harder because you have some of those patients that are young that don't want to open up, and some of those patients that are in their age where they're stuck in a certain position they do not want to release to be comfortable or communicate with you.
Okay, and generally hospice, again, we talked about you're dealing with people who are within their passing time. How do you deal with those families who are, let's say, overbearing, overprotective, and who require certain elements from you that you necessarily may not want to
There's only
do?
one answer to that, and that's God. Because with God, everything is possible. And as long as I allow and ask God to give me the strength, I'm able to build myself, to prepare myself for those things that those people are going to go through once the passing time has come.
Okay. And what would you say that your communication strengths are?
Communication strengths, I would say, as far as dealing with the families. It's hard to get along with the patient if you can't get through the family,
Right.
and vice versa. So it's good to have that communication skill with both of them.
So you would say you're empathetic?
Right.
And probably if I had to guess, I would say it requires a certain humbleness to be able to, because I would imagine if it was someone in my family, I'd be crazy. I would want certain demands. You're not in the same mind frame because, again, you do know that passing time is up and coming.
That's correct.
Okay, let's see here. Have you had any cultural competency courses, such as intercultural training or anything that would help you whenever you have